So in Pakistan, what we do, when we come there, 3 months post Pakistan flood, it's most basically all about post flood and early recovery assessment. So we're gonna look into situation analysis. We'll zoom in what Pakistan. Pakistan, if you know, is located in Southeast Asia. South Asia, sorry. It has 4 provinces. Pakistan neighboring country is Afghanistan on the northern, and Iran, and here is India. So it has 4 provinces: Punjab, Sindh, Khyber Pakhtunkhwa, or I say KPK, and Balochistan. And it has 2 federal administrative territory. One is Islamabad, one is in Karachi. So we just give a overview. The situation is about the populations, the socio-economic background, the weather and climate, education, and about health. For the population and culture, we have know that Pakistan is one of 5th populous country in the world, which has consists around 220 million people, and majority is a Muslim country with significant minority population such as there has Hindus, Christian, also Sikh, and has really rich culture heritage, which is influenced by their religion, history, and geography. And about the weather, it has the climate is quite different from the south to the north. From the south, it's more hot and arid, hot and dry. In cold near to the Afghanistan, which is a mountainous area, which is usually cold weather. And the country experience monsoon rate from June to September, which in this period where the flood happens during the monsoon period. And based on the 10 risk countries, Pakistan has scored one of the 10 countries most affected by extreme weather from Global Climate Risk Index 2021, and also from Climate Watch. So from socioeconomics, it is a lower middle income country with GDP per capita around $1,259 compared with Malaysians, and which is our Malaysian GDP is around $3,000, and its economy usually dominated by agriculture, where they also export a lot of cotton, wheat, and rice, and also some manufacturing sector such as textile. And it has federal parliamentary republic, and we have to know the political situations as when they are facing the disaster. They also has facing instability of political situations and change of government. So it makes the people more vulnerable. The situation more worsens. And we look into educations. Actually, they have improving their education rate, literacy rate from 60%. And however, from this education, we still have seen the significant challenges upon giving providing quality education, especially for women or female who want to go to school in Pakistan. For health system, it has mixed public and private providers. They also have primary, secondary, and tertiary healthcare. And health insurance, usually either for the health financing, they also have their own health insurance, which is very limited and out of pocket money. And the challenges for health systems, of course, the limited funding of healthcare. They have limited inadequate infrastructure. They're also facing shortage skilled healthcare professional, whereby most of the doctors doesn't work in the country but work into other country because give more payment. And also disparity in access and quality of healthcare service, and also post the disaster increased burden of the disease. Furthermore, the allocations for the country's total budgets for healthcare in September 2021 only 2.7%. Okay, well, let's go to the story of Pakistan flood disaster 2020. Someone said it's also known as climate natural disaster because it happened in combination factors due to heavy monsoon rain during that period, June to September. On the top of that, there is high snow melt because the location of the Pakistan is nearby to Afghanistan, which was near to the lots of during that time Afghanistan also facing disaster flood, but never been informed due to the high snow melt and inadequate infrastructure. So this led to the severe flooding, landslide, and flash flood. So that's one thing. And second is changing of rainfall patterns. They have seen in June, the heavy raining affecting the areas usually doesn't get hit by the monsoon, especially in south and central Pakistan, which is more to dry season. But during that time, Sindh and Balochistan reach higher rainfall precipitations. And then it quite shocking for them because last year they was dealing with moderate to severe drought. But during that period, it suddenly got lots of rain, which is lead to drowning. And in August, there is more intense rainstorm happen, and which is what the wettest Pakistan was ever seen for the past 60 years. So in that particular month, in August, they received 3.4 times national average rainfall. So it's more to climate change cause that contribute to the Pakistan flood disaster. So where we can see short report from the UN or OCA, we can see how the evolution of flood water extends. Start in July, starting from the northern part, because during that time, 2 month, 3 months period is the how Afghanistan got flood first, then go to KPK on the northern, and then suddenly at the end of September, we can see the water still stagnant area, but in the Balochistan area and Sindh area. So what footage that you always seen in the video about the Pakistan flood usually is footage coming from Balochistan and Sindh area, whereby water is still stagnant, and then the impact's really severe to the southern part. So based on a report from United Nations Office for Coordination of Humanitarian Affairs, OCHA, they put a flood report response that what their needs. So at a glance, there's around 33 million affected for the past 3 months. And they require around 816 million US dollar for funding requirement, especially focus on more for food security, second for shelter, third for I would say the protection, nutrition and health. So in this period, around 20.6 million people in need, especially for food, protections, and also for shelter. So they plan, if they get some disallocation, they can help around 9.5 million people targeted. So around here, we can see the area in Sindh, the most affected area where all the house being damaged and destroyed due to the flood. And based on National Disaster Management Authority report in 14 June for the past 3 months, they mentioned that around more than 1,600 was killed and 20,800 injured due to the heavy rains and floods. And out of this, 1/3 recorded death and injuries are children. And Sindh and Balochistan, Sindh recorded nearly half of death and 60% of injuries. And Balochistan and KPK also reported the same amount. So this is picture view. So we see that Balochistan the most affected area, but some part of KPK also being affected. So it is actually a humanitarian response which is led by the government of Pakistan. They have established their own national flood response coordination center, whereby they want to coordinate all the helps humanitarian aids from other country that will come, and already local or international responses. Then they identified the priorities, which is food, agriculture, health, water, sanitation and hygiene, shelter, and non-food items. Non-food items we refer such as to the hygienes, such as soap, pill, or anything that they need to use. So basically, just overview what is humanitarian assistance and disaster relief. Actually, is something that we can seek to save life and alleviate suffering of the crisis of affected populations. Usually, the assistance can be direct assistance or indirect, or sometimes we give infrastructure support. And all these humanitarian assistance must supposedly obey the principles of basic humanitarian assistance, which is humanity, impartiality, and neutrality. And when the international HDR comes into picture, when the country exceed the coping mechanism and capability to manage the disaster, either the government is either incapable because the scale of the disaster is too large, or they are unwilling. Sometimes this unwilling because of the disaster related to conflict, such as war or like that. So, and even the country doesn't ask for help because it's humanitarian things, it's so humanitarian action can be taken up, because if there's no further action, it can lead to humanitarian crisis. Okay, overview about Mercy Malaysia. It actually is NGO, non-governmental organizations, and is international non-profitable humanitarian organization established in 1999. First responded to Kosovo crisis, and then after that, evolving day by day, year by year. Is focused on providing medical relief, sustainable health-related development, and risk reduction activities for vulnerable communities. So usually they work with local partners and communities so they can identify their needs and provide necessary assistance. For the in Malaysia, Mercy Malaysia team, actually the volunteers and staff is variable. It's a mixture of medical professionals, engineers, logistics and other social workers. Who actually we are being trained first before we deploy to another place that we want to go. So for our objective for this mission, we have given a task, a few objectives, usually by the HQ to do what we want to do in this mission. So usually we want to assess the current health needs, and we want to support the medical health services that are available, want to monitor the ongoing projects, and then we determine the critical needs on the ground and provide the reports to the HQ lah. So in our for Pakistan deployment team, actually first rapid assessment team was sent early September 2022. Then we are second team which was mobilized on 6 October. Okay, our second deployment team, during this time there is 6 persons. From the right is Mercy Malaysia Logistic. We have logistic people, we have team leader, Dr. Muhammad Iqbal from Mercy Malaysia, and we have 2 ONG specialists, Prof. Nazima Idris from IMU, ONG specialist Dr. Siti Maisra from HKL, and emergency department Dr. Anis working in private sector in KPJ, and me, and 1 logistics staff and security. So we depart from KLIA to the Islamabad, around 6-hour journey. Then over there we conduct assessment of affected area and monitor the previous project as what the objective that we have to achieve. So during this task, we already been given a task to focus our humanitarian aid to the northern area, is KPK, because as I know, as we informed, the Balochistan and Sindh area always been concentrated by a lot of humanitarian NGOs from other country and international country. So they're lacking of NGOs or anyone supports from to the northern part, which is also affected by the flood. So KPK, we go to the 2 district, because it's one in Chasadar, one in Dera Ismail ataupun di Aihan. So from we divide our team from 6 people to 2 teams, 3. So one of the team went to di Aihan. From Islamabad, we go to di Aihan. The journey took around 6 hours roughly, and then went to Adil Sipra village first. Then we went to Birahi village. Okay, in Adil Sipra village, actually it's the first program done already from the first team, whereby they supply all the clean water, because they have problems with access to clean water. So what they do, they supply the clean water using the water tank. They rent a company who can send this clean water and give to this community in Adil Sipra village. So we monitor there. So we can see people queuing up, especially children, to get the water to fill up into the jerry bin, or the jerry, or to the pail. So then when we go to Birahi village di Aihan, where we do the situational assessment, where from interview the local peoples, and then we do the house visit and site visit. So introduction about Birahi village in the Aihan, actually it's around 300 houses in the village, around 2,100 people staying in that village. Its socio-economy is quite poor. They are living by working as a farmer, grew sugarcane, wheat and barley. And during the area around the Aihan, in the Aihan village, they have 2 public facilities only, which is a school for boys and girls. So, and the house usually made by mud, and in each house around 6 to 7 people staying together, and they shared common latrines and kitchen. And because of that, they also shared together with animal shelter, and animals staying together with them lah. So on the day of the flood event in July 2022, based on the story from the villagers, a flood occurred due to continuous heavy rain for a week and sudden rise water level in near dam. Because their village is nearby to the dam, so the water gate of the dam was open but never been informed to the villager people. So that's why it caused 200 people died. However, some of the villagers managed to take refuge. They climbed up to the rooftop of the primary schools, and others has been to be rescued by boats. This situation happened early morning around 6 a.m. So post 3 months of flood disaster, this is what we can see. There's been damage of infrastructure of the crops. That's why they're still living in shelter beside the house. And then a villager shows that the compound area where the temporary tent was built, and they still made the house from mix of clay, hay, and cow dung, because only that things that they have the resource. They have very limited resource. And this what happened. We can see inside the house was filled with mud and open shed kitchen in the ruined house. Okay, this is the crops. You just imagine your house in front of you usually is greeny leaf, greeny sugarcane. Post 3 months, this is what happened. The massive flood has ruined the crops and unable to use and damage their income as a sustenance resource. And then these muds caused harden and damage the soil and the nutrient and it unable to suitable for growing crops. They have to remove all the muds first before they have to plant a new harvest new crops. Actually, it's short videos from my friends.
This is the crop area. Dapat tanam padi, dapat tanam macam-macam, but everything has been swept away by the flood. Yeah, what's missing is all this layer of mud being brought by the flood, so it's can no longer be used for planting any crop.
Okay, it's about the school. You can see this only public facilities there. The school being damaged. The toilet also being damaged and able to be used. And it's a snippet video
This
about
is school
compound
for the boys, and as you can see, everything is covered by at least 1 foot deep of mud, and it becomes so hard. So basically the school is being washed out with the flood, and you can see the watermark there. The watermark is there, the yellow line, and the water actually wash everything from this direction, which caused the collapse of the wall. And it's only there. And the school hasn't been used since the flood, almost 2 months ago. This is
Okay, it's quite sad. The school just started because of the post-COVID, but they have to stop back because of the flood. And yeah, this most saddened part about the wash, there's no clean and safe drinking water. Most of the water handheld was broke. And then they have to walk around 11 kilometers nearby to take the fresh water, clean water. There's a pond nearby. So instead of going there, just take water from the pond directly using a pail and a cloth act as a filter. So the water is cleaned and they directly drink from the water. They try to, this is the point that we'll talk just mention about. They're trying to dig a new well, but the flood caused the ecological and land structure becomes problems as the water in the locations then becomes salty. Even that every time they want to dig a new well, the water comes salty and it's not suitable for drinking. So that's why they think this is the only source of water that they can use, as they see that after they filter the water, the quite clear and less murky and less odorless and have a good taste. That's why they're still drinking from the water from the pond. And usually they shed direct electric or toilet. However, because the toilet also damaged, the toilet option is open outdoor toilets only. And there's increasing cases of infectious disease such as dengue and malaria, and also waterborne disease like typhoid or cholera has been reported. So our recommendations, after seeing these situations, we try to set up and establish proper form of water purification and treatments and proper water supply or distributions. For the immediate actions that we can think of is to supply them with fresh water, clean water as in the previous village that has get so far. And in second term is this water purifications, mobile water purifications. There is two options. One is sky hydrants, if you ever know or not. It actually is sky hydrant, ultra filtration system. It actually is mobile water filter that can be used about this for each sky hydrant around 10,000 liters for clean water daily. It can be used either you pumping or you connect with the solar systems or water pump, or it can be device, and it can treat the most non-saline surface and groundwater. Or second option is one of the product from Waterform. Sky Hydrant is product from Australian industry, Australian company, and our Water Roam is from Singaporean. It's actually very good device, which is they can be water filter systems, plug and play, where you take the water points and then you can filter and you can get water, clean water at least. And for sanitations, suggest to making portable latrines and health and basic hygiene promotions. We distribute hygiene kits, and we plan if there is fund to clean up and repair the toilets and water supply of the school and in the school itself, and set up a mobile clinic. That is for the IHAN. For Chasada, second place that we go is another part of Chasada, near Pashwa in KPK. It's around, it has population around 1.6 million, 64 villages. Village council is much more bigger. And then most area of this also being affected with the flood. You can see the watermark here, more than this gentleman height, more than 2 meters, and all the crops already die. So activities in Chasada, actually they already started with the mobile clinics, and during that time we have collaborated with local NGO, local partners, Al Hikmat. So they already run about 22 different clinic, at different place at one time every day. And then clinic hours from 9 to 2 o'clock. In medical team, we have 2 doctors, 1 pharmacist and 1 lady woman or as assistant, 1 interpreter and 2 general workers. This is the medical, the human resource. So what the service offers, we do some outpatient consultations. We have to separate between men and women and also children, and giving medications, refer to the nearest hospital, health promotions, and hand hygiene. This is doctors over there giving consultation to the children's, and then this is for lady doctors in mobile clinics. Treatment, medications being disposed by the pharmacies, and then we do some health awareness promotions. We do some hand hygiene technique practice to the kids. And usually I just want to share, previously we give some post, we do the health promotions, usually we give some chocolates or candies, but we doesn't want to because the kid throw away the candy bungkusan tu, so we change to fruits, so that at least they can get some healthy nutritious foods, such banana or any fruits. And then we set up the women specialist clinic, as we brought 2 ONG specialists here. So usually we offer service such as an antenatal checkup, postnatal and women's. We having a portable ultrasound and hemoglobinometer we bought in Pakistan itself, in Islamabad. And then it really helped to for the doctors to make the decisions. So for nutrition assessment, in Chasada, we look into special focus in nutrition. So we do some nutrition assessment. For a little bit background, for Pakistan nutrition report, based on UNICEF report 2022, almost 50% of children under 5 die due to undernutrition. And then recent floods have severely affected food security for children under age of 5, as most of the breadwinners are families, so they have less of income. And then flood have destroyed 70% of the crops and 30% of orchard areas. So so they have a lot of food problems. And furthermore, 25% of livestock lost at least one livestock during the flood, and caused increased price of the food, basic food, and it's increased food security and food availability issues. So based on Humanitarian Pakistan Nutrition Report 2022, the prevalence of wasting among young children is more than 17.7%, above the international punya emergency threshold, which is 15%. 40.2% are stunted, 28.9% as underweight, and then both boys and girls facing similar problems. And this nutrition report also mentioned that women's reproductive age experience double malnutrition, with 14% is undernourished, 42% anemic, and majority have vitamin D deficient. Okay. So factor contribute to undernutrition. We know that first the families struggle to afford the nutritious food, lack of education, food insecurity, um, and then poverty. The big issue is poverty. So second is poor sanitation and hygiene, and limited healthcare facilities, whereby difficult for hinder them to early detection to manage the malnutrition. So we do the nutrition assessment. We try to determine nutritional status child less than 5 years old. So that those who attend the mobile clinic. So we do the methodology through anthropometric measurements, dietary assessment, practice and behavior interview, and secondary data. So nutrition assessment, we done to 155 children under 5 years old in KPK. So we found that is wasting actually refers to the rapid weight loss and depletion of muscle and fat tissue. So actually it reflect the acute malnutrition. And Alhamdulillah, only 6% of the respondents facing acute malnutrition. Uh, how about stunting? Yeah, stunting is really things. Stunting actually impact the growth and development and resulting in shorter stature. So actually compare the height based on the average of specific age group and gender lah. So it usually reflect the associated with insufficient overall caloric intake and poor dietary quality. So we can see only 50% are normal, but 34% are facing chronic malnutrition. They are really, really short. For underweight, usually we found that underweight is individuals' weight is lower than the average weight for the age and gender, and 25% responded were underweight lah. So yeah. However, we know that currently the underweight children can be at increased risk of undernutrition. So after that, we go to the nutrition assessment. We went to the interview for mothers. We interviewed 6 mothers. So based on the 24 hours food recall, okay, for infant less than 2 years, because of their poverty, they have really difficult in food access. Usually, the babies are breastfed on demand, and they are given liquid tea whitener instead of milk. Yeah. So, if their homes have their own cows or goats, they are fed with fresh milk. And the way they wean the babies is paratha and milk tea. It's different from us. Okay, we go for soft food, soft diet, mashed potato, but they are not. Straight away to tea and paratha. For breakfast, usually paratha and tea. This is for 5 years, more than 5 years children. Lunch usually take paratha, cereal, legumes or vegetables, and sometimes rice. Dinner is usually leftover from lunch or skip, Kids below 5 years eat the same food as their family but in smaller portions. And usually meat is consumed once a month or when there is a visitor. Actually, this is a picture when we come to the house. So I think during that time, we being served with some mutton, curry mutton. And I think after we ate, they have the opportunity to eat the meat for that month. It's quite sad. So practice and behavior. When dia punya practice and culture is household follow hierarchy while eating meals. It's meaning that they'll have to ask the husband eat first, the breadwinner or the grandfather, the male, then the children and the others. So if you are female, you are pregnant, I think you're the last. Yeah, we have to. They have to make prioritize the male or the husbands. Yeah, that's the culture. Second, husband or in-laws borrow meal material with the daily wage. So what husband and breadwinners provide, that's they have to cook with that things lah. Usually last for 2 days, and then if you are wealthier, you can see there's a cattle or goat, and then floods. Overall, floods have greatly impact their capability to provide food for their families. Yeah. This actually is the kitchen. We'll go to the house. We can see this outdoor kitchens area. So the good houses or quite wealthy house, they have gas supplied centrally, and but they're shared together with other people. And yeah, they still use firewood for cooking if there's no gas supply. They shared open outdoor kitchen. Okay, this is the water handheld. This is the kitchen. Okay, common kitchen staples usually flour, oil, sugar, and lentils. Vegetables such as potato, cauliflower, and spinach or tomatoes. They also have a refrigerator. Unfortunately, this refrigerator only for keeping storage, and then it's for making ice only, and keep the fermented dough. So nothing much as compared with our own refrigerator. Mostly 4 out of 6, all the refrigerator is empty. So we also interview with the doctors at the locality. We have some discussions about their nutrition status, what the kind of conditions, and we come up with recommendations and suggestions. We plan to have a supplementary feeding programs, usually for so we try to supplementing ingredient local food, flour or rice, and on the top of that formula milk, especially to those who doesn't have the access to the milk, and then targeted ongoing distribution. It's quite really a difficult situation, but we really want to get this to have targeted ongoing distribution instead of one-off blanket distributions. And on the top of that, we have to go for nutrition educations. Maybe we can do some dietary modification advice, cooking demonstration, train them, and then training for trainers for community empowerment. So they can easily conduct the anthropometric, teaching healthy balance of diets, and then advocating for breastfeeding and pictorial handouts. So we also expecting the challenge of these programs about the accessibility, the coverage, the quality and the safety of the food, and how the sustainability of the programs, how long this program lasted. Usually for the humanitarian aid, you have to bear in mind based on fund. So we really have to think of how much fund that we have and how longer the fund can support these programs. It's really take into account. And then the cultural and social acceptance. Because we know that every culture is different. When we introduce some things like food, is especially meant for the kids, but the family members take it to it. So it's really have to take into consideration, and how to monitor and evaluation of the programs, whether this program is successful or not. And the important parts when we doing deployment, we doing human access internationally, we really have to identify the current capacity. So over here, we already identified our local partner for mobile clinic program and distribution of clean water. This local NGOs Pakistan, which is PIMA, Pakistan Islamic Medical Association, and Al Hikmat Foundations. So with them, we discuss and we try to support and contribute in material and financials. And then meanwhile, Mercy Malaysia usually contribute into material and financials. And however, the local people who are the one who have the human resource, logistic and setup. And also for this new program, targeted nutrition supplementary programs, we also try to collaborate with other NGOs. And then as a PIMA has conducted nutrition program before, so we think there is a potential more potential programs, potential that we can collaborate for this program with them. For this example, this is our team, and together with the local NGOs. Here, the lady doctors, the pictures. So during that period, also we went to we have this established collaboration with new NGOs, so that we have potential for collaborations. We went to the Hikmat hospital. Apparently they have their own hospitals. It's one of the surgical room. Quite surprised because the surgical room can be done simultaneously, 2 operations at one time. This is a public primary care unit, primary care clinics in Chasada. So for lesson learned, actually it's important to conduct thorough situation analysis and reporting, because this information is really important for us to make a decisions and report to the HQ, so that we can proper plan future and manage the financial programs or another programs So public health measures plays important role in management post-disaster, especially we can see all the outcomes setback after disaster occurs. And collaborating with local partner is really crucial so that we can ensure the implementation of the project is successful. And you have to work as a team, complementing works of other agencies, and make sure the project that we want to do is sustainable, affordable, and culturally accepted. And furthermore, disaster preparedness is crucial to reduce the risk and severity of the disaster. Yeah, take home message where humanitarian networks never end. That's all. Thank you very much.
Thank you very much, Dr. Khairunnisa. Okay, so we now have some time for any questions from the floor or any, thank you, Akram. Any questions or any discussion you like to bring to the table? I open the floor. Can just turn on your mic and fire away. Okay, while we're waiting for some of the questions from the others, just do just a brief follow-up from the presentation by Dr. Khairunnisa. So we see that public health intervention is very comprehensive approach. So it involves all the subdisciplines of knowledge on epidemiology, environmental health, disaster management, right? And we know from public health that the essential needs of living, like water and food, shelter, hygiene, all these are important components when it comes to the health of the population. And in this case, this disaster especially, it affects the vulnerable population, right? The population is vulnerable in the first place, even before disaster. So when disaster strikes, then um, it the problem can become enhanced, right? So you can get higher mortality and so on. In spite of the disaster, um, but this is probably just my assumption, but there's some uh, positive takeaway from. I wouldn't say no one is asking to be involved in or disaster to strike them. Or no one wants disaster, but um, I'm just wondering whether if let's say they this did not happen to them, okay, this floods. Um, do you think that the problem, underlying problem like malnutrition, would have been picked up if this event did not occur? What do you think, Dr. Nisa? Any comment on that?
Sometimes when I went to see this situation, I also have that kind of point of view. Yeah, this situation actually is like blissful conditions to them. That, yeah, to those who being survived because being picked, and then the issues being informed, being bring forward that yeah we have malnutrition issues. However, yeah, what I could say is quite unfortunate for them,
Mm,
but fortunately they are being found. Yeah, and
yeah.
that's why we cannot do much. I mean, like for me, as a public health or as anyone, we try to help them. We can help a lot all people, but we can help as many as people as we can in between our own capability and capacity. Yeah, that's number one. And second things, what I can learn from the lesson that I can share is the politic stability is really crucial, because when I heard after today is almost like 8-10 months, actually our program being suspended. Why? Because the political disruptions there. If there is like Imran Khan suddenly drop off, blah 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 blah. Yeah, and the aids cannot be given to them because of this issue, because they really have the government doesn't want to accept or restrict the offers or contribution help from the international assistance because the political issues and everything. So disaster is one thing, political issue is one thing, and then as far as possible, as far as we can, we try to help the best that we can with our own capability and limitations. Yeah.
Okay. Yeah. So fortunately we are talking about this on in an academic platform. So there's some freedom of speech here, right? When it comes to, we're not trying to get politics involved in this, but we do know, we understand that um, the overall health of the population of the nation. Uh, we look at the history of public health. We know that the improvement in the overall health of the community of the population, um, the probably the most biggest contribution is by alleviating things like poverty, right? Even if we know that that's the highest contribution of course, including the healthcare system. Yes, healthcare system has its contribution, but general things that works outside the healthcare system, things like um, um, elevating the living standards of the population itself. So it involves as we as a country progress, then the health should progress as well, right? So and we, if you look at, I don't know about Pakistan, but you did mention that the uh, allocation, budget allocation or expenditure towards healthcare, um, was, you did mention it was on a bit on the low side, is it?
Yes, like 2.7% is very
Yeah,
low.
yeah, 2.7%.
They are contribute more on army.
Yeah, right. So if you compare, let's say, Malaysian, the Malaysians expenditure towards healthcare, we spend about roughly about I think 5% or less, roughly about 5% of the GDP of the country towards healthcare. So that's uh, it's not high, but it's actually much lower than other countries, especially if you look at the US. But we still managed to, well, Alhamdulillah, we still managed to uh, achieve a reasonable um,
Good
health
outcome.
statistics. Yeah, the output. So, but I think maybe 2.2% maybe too low for a country like Pakistan. Okay, so but that's a much bigger story there, bigger issue there. Okay, anything else? Any from the floor? Any questions? Okay, perhaps the other thing is about the when it comes to real life um, approach to public health. When from your experience from this Mercy mission, so maybe you can um, elaborate a bit on the practical side of things, okay? Because we have ideals and we have limitation. We have ideals on what we do. We learn in theory, what we can perform, what we want to achieve when it comes to the needs, healthcare needs, especially in times of disaster, and the limitations that you have, the challenges that you have on the ground during the actual mission itself. Maybe you can give some input on that, with the how much you can do and what are the challenges when during this mission when it comes to the all the public health issues.
Okay, I think for example, I think for wash, for examples, about the clean water. Clean water is very what crucial. So for, the issues first, I think is about when we want to introduce, let's say, first is we want to get a local providers who can give what idea what we want to supply. I mean, what kind of things that we want. That's one thing. Because sometimes we know we want to get quality good water, sufficient, clean, and so forth. But when you want to bring it, we have to find a good resource, a company or anyone that can implement that things. Sometimes the implementation is really important things. Whereby second is the how it be implemented, the human resource, the source itself. Third is the end user. sometimes when we, let's say we give the sky hydrant water, we put set up water filter and everything, and we teach them how to use. But and of it, if the user, if the community have the educations to use this one, is such a waste. That's why I think this is the things that we have to really look into, from the how we want to implement the process and the end user. So whether the people, the community want to accept the clean water, how they want to be used, how to taking care, managing that, is another things. So the thing public health issues that we have to thinking about. Sometimes they can do, but maybe not into our spec, healthy spec or whatsoever. Yeah, that's things. Second, same goes for the nutrition programs. We want like this, but when the end user said that if by standard, it say if you have malnutrition problems, you have to give the what the packed food, WHO standard, this kind of things. But when we go to the people community, they doesn't like this food. They doesn't want to get this food anymore because the taste is culturally unacceptable by them. So we have to devise something that have similar calories, but the community be accepted. So things that they have to think beyond like that. That's I would say.
Thank you, Dr. We have, I think, Dr. Prof. Anita raised her hand. I believe she have a question, Dr. Prof. Anita.
Thank you, Dr. Zaid. Thank you, Dr. Nisa, for a very knowledgeable experience. My question would be, one of the lesson learned that I saw was that when you were there, you tried to have collaboration with other NGO who came and assist, right? Because in time of disaster, resources are very scarce. So in Malaysia, let's say in Malaysia, we have a lot of association doing humanitarian assistance, right? So in the context of our local, what kind of collaboration that you have among the NGOs?
Um, a quite difficult question for if you going back to local part, okay, local parties in Malaysia. Okay, basically, if I'm not mistaken, nowadays after post a few flood disaster event, they learn something from all the NGOs. So during the period of disaster, we have to come together and coordination should be made. So I have been informed nowadays, NADMA take a lead take a lead to organize as a coordinator for all the NGOs to come and sit down and to segregate. I mean, which part they can work with, like that. I think NATMA should be do that, but I think they are planning to do that, but I don't know when, whether it's really implemented. But I heard with my friends or my colleague, they are doing that lah. But for actually, it's happen in really really big disasters, they do that, but in small part, I'm not so sure. I doesn't beyond my knowledge. But yeah, for me, coordinations in NGOs is really important. So in during that Pakistan event, the government take a lead, and then with OCA, OCA is apa nama penuh dia, organizational control humanitarian assistance, something like that. They come across, they come into, and those international NGOs who want to come, they have to report to them and report the location so that we cannot being concentrated in one place. So yeah, that's my take points. Thank you, Dr. Anita.
Thank you, Prof. Anita. So I suppose we can, if there's no more questions, I think we can end this one, the first topic. I hope the presentation by Dr. Khairunnisa has provided some insights to many of us. Not many of us may have this kind of opportunities. There may be future opportunities if you look for it, and I think it's a good exposure for especially those. We have a lot of undergraduates audience here, I think, from UMKT, which they can see the practical side of things the practical side of public health. Okay. So thank you very much, Dr. Khairunnisa, for the very nice presentation and sharing of experience. on your mission with Mercy. And we carry on with our second topic, which is not less important. It will be our speaker will be Dr. Lisa from UMKT, our partner university in UMKT, and she'll be talking about um, comparing about successful aging. So we know that aging is in Malaysia at least it is a big topic now when it comes to aging, and I'm not going to take the limelight from Dr. Lisa, so I'll give her the honor to present her uh, uh, presentation today. Okay, with that, I invite uh, Dr. Lisa to present her presentation. Okay, please over to you, Dr. Lisa.
Okay, thank you, Dr. Zaid. Can you uh, can you hear my voice clearly?
Yes,
Okay, okay. I will try to share my screen. Is it my screen clearly seen?
yes, we can see it.
Okay. Uh, okay. I will try to present. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon. I will say thank you for the first for the epidemiology unit from UPM for the it's an honor for me to be able to contribute to continuous medical education event today. And today I will present and ask audience discuss regarding successful aging, predictors, and comparative study across countries.
Sorry,
Okay,
Dr. Lisa, can you maximize the window? Your
okay, okay.
PowerPoint. Okay, thanks.
Is it more clearly?
Yes, okay.
Okay. Okay, the epidemiological transmission has major influence on the demographic transition as well. In the epidemiological transition, there is a change in the pattern of the disease in society from the infectious disease to non-communicable disease. And in this slide, according to the change in each phase, we can get the information that improving infrastructure, condition, development in medical and health technology have a result in lower death and birth rates. Discuss a change in age structure of the population to an older population structure. Uh, this is can increasing life expectancy as well. Okay, according to this picture from WHO 2020, the picture show that globally, life expectancy has always increasing in the last few decades. And the real impact of increase in life expectancy is also increasing the elderly population. And aging population is usually always in a negative perspective because it will be a big burden for their family and also a big burden for the countries as well because many think this will drain healthcare and others. But someone who takes good care of themselves financially and health physically, mentally, spiritually, and maintains a good relationship with the community will be sure in the next 20 to 30 years of their retirement, they will go through with the good health. In fact, everyone will be grow old. But how can we pass our late life with successful aging? Okay, successful aging is a concept that has gained popularity and relevance internationally among gerontologists in recent decades. The most widely applied successful aging framework is suggested by Rowe and Kahn model. They define successful aging as a three components simultaneously. There are for the first, we should minimize risk of disease and disability, and then maintain our physical and cognitive function, and also continue engagement with life. Okay, for the first, we should have a low probability of disease. The first essential component of successful aging. This is a essential component of successful aging as a uh, because not only about the existence or absence of an illness within the older people, however, how of the older people is able to move away from the factors that cause the risk of the developing its disease in themselves is more important than that. And people have an awareness of the positive lifestyle that must be followed, such as avoid to smoking, and then perform high physical activity and manage their stage. The second essential component is we should have a high physical and cognitive function. Physical and, physical and cognitive function capacities are activity potential. Factors that can influence must be minimized by making effort, such as physical activity that supports health and keeps adding knowledge or skill and maintaining memory. That's why education is the main predictor that influence as person's cognitive function. The last essential component of successful aging by Rowe and Kahn model is we should achieve the older people should continue to follow social activities in their environment or those carried out by certain organizations. The important relation that must be owned by the older people is the existence of social emotional support and instrument support, which is includes giving assistance to others directly or engaging in activities that benefit to others. And to achieve good engagement in our life, we have to measure for the first, we should still have a good social relation in our late life. And such as we have a social support from our family and our environment, and we also should engage in various social participation. And we also have productive activities. Okay, we try to compare and learn about the successful aging across countries. For the first, from Indonesia, according to uh, two studies in the screen, and among these two studies is a longitudinal study that was carried out from the 2007 to 2019, sorry, 2015. And it is known that successful Indonesian has decreased from 23.6% to 5.6%. And this is maybe can influenced by the the community in Indonesia have uh, in Indonesia occurring changes the culture like consumes culture for daily dietary pattern and have a lower physical activity for now, and then also have a minimum contribute to social participation. Okay, in this slide, we try to compare and see from the two study in Malaysia. Uh, in Malaysia, successful aging it's more high than Indonesia, and prevalence for successful aging in Malaysia was 37.5%, and the older adults in Malaysia who have achieved to successful aging is those who perform high physical activity, good social support, and being non-obese. And this is a study from the Singapore. There is one study from Subramaniam et al., and they revealed that the prevalence of successful aging in Singapore was uh, 25.4%, and the main component of older adults in the Singapore to achieve successful aging is having much more active in engagement with life as compared to their counterparts for the other countries. And according to study result from Nakagawa et al., which compares successful aging in East Asia such as Japan, Korea, and China, Korea had a success rate of successful aging was 13.3%, while China and Japan had a successful rate for 15.7% and 29.2% respectively. And the study, which compare 13 countries, uh, was conducted from 2010 to 2020 from Rich et al., conducted a systematic review of the lay perspective of older adults in successful aging. The concept of successful aging may be different across culture and countries. Um, but there are common components in for such as in North America as a multi-ethnic culture. The domains of successful aging expressed by lay older people include social engagement, positive attitude, independence, physical health, cognitive health, and spiritually. The successful aging component expressed by Western Europe, Middle East, Asia, and Oceanic include social engagement and positive attitude, independence, including the security of financial, physically health, and cognitive health, and spiritually. Okay, people who are still healthy at the age of 60 and over and as asset to society. We have to take advantage of their experience, their wisdom, and their activity in the community will be very meaningful, for example, as a volunteer activities. And in the end, we hope that our older adults will be healthy, independent, and self-sufficient aging. Okay, that's all my presentation, and thank you, Dr. Zai.
Thank you, Dr. Lisa. So now I would like to open for question and answers from any of the audience. So Dr. Lisa, can you give a brief, maybe a short summary on a summary of what are the on the comparison of the between countries? So what can you summarize from this comparison between countries?
Okay, thank you, Dr. Zaid.
Hmm.
So, the comparison for the countries, for the all of the countries across countries today, um, in the Asia, the prevalence of successful aging, the highest prevalence of successful aging is in the from Malaysia and Japan, and um, for several countries, to achieve successful aging, the older people who have engaged with the success with engagement with life, like active engage in the social participation and have social support from his family and from the environment. Yes, like that.
Okay. Okay. When it comes to aging, successful aging, right? The matrix of the measurement of successful aging. So you mentioned the major components of successful aging, right? On how it is being measured. Um, Maybe I missed this out, but can you maybe give a bit of background on how do these successful aging is in terms of the how do they measure it? Um, is it being developed from where does it develop from this measurement? Is there some um, like a bias or some components which can bias the result a bit? For example, let's say you have some, you say just now the spiritual component thing. So are these like from developed from a West perspective, whether a Western perspective or Eastern perspective has any bearing on how they develop this successful aging?
Okay, sorry,
Yeah,
Dr. Zaid,
when
can
it
you
comes
repeat?
to the successful aging, right? Um, so there are many metrics or measurement that people use to have like a macro scale measurement on the prosperity of the population or the country, right? So we have so many things, and now it's successful aging. So is this measurement, this comparison, is it widely used? Is it being accepted as a standardized measure, as a comparison between
Mm.
countries?
Okay, yes. To measurement the successful aging, it's widely used using the raw income model, and it is applying to many countries. And the raw income model, there, like I said before, there are three components we should achieve simultaneously, such as we should achieve the have a low probability, not only have low probability, but also we should control the risk factor, like avoiding the smoking and maintains our stress and um, um, have a high physical activity. And then in the second component, we also achieve the physical and cognitive function, high physical and cognitive function, and the most achieved to successful aging. The third component is we should engage in the social participation and have good social support. uh, and like your us before, from the all the country, the achievement of successful aging, like Malaysia, Singapore, and Indonesia, and several countries from the Europe, uh, the older people who have a successful aging, uh, they have still active and engaged in the social participation and have a social support from the family. Yes.
Okay, thank you very much.
And so for the Malaysia, from the current study, Malaysia has have a high prevalence for the successful aging from the Asian countries. Yes.
Well, yeah, it, yeah, but yeah, when we use the term prevalence, yeah, it does sound like it's supposed to be something positive. High prevalence, usually when we relate
Maybe,
to disease, high prevalence
yeah,
would be
maybe
better.
maybe you can maybe you can sharing as
Yeah,
well, Dr. Zaid.
yeah, so high proportion. Okay. Yeah. Okay. Right. Any question from anyone else?
Probably just a comment, Dr. Zaid.
Yes,
If
thank you.
Puan Halimatus was here, probably she would share from UPM perspective what we have done for my aging, because we have
Mm,
a special institute, right? So
mm,
Dr. Lisa, whenever you come down, probably you can visit also the institute.
Yeah, thank you.
yeah.
For sure.
We have a Institute of Gerontology, and our the apa ni pengarah, the director is currently one of our lecturers, Professor Halimatus. So okay, we have one question from Dr. Muhammad Hafiz from in the chat box. Is asking, is long lifespan a component of successful aging? Is long lifespan is a component of successful aging?
Sorry.
Dr. Muhammad Hafiz is asking, Dr. Lisa, is long lifespan, meaning living longer,
Mhm.
uh, is a component of successful aging?
Okay, thank you for the a good question for Muhammad Hafiz Baharudin. Um, According to the raw income model, the component they also have three component like I said before, and to achieve lifespan I think we should also achieve three components like in the theory of from the raw income model. Yes. So lifespan I think is not essential for component of successful aging, but the essential component of successful aging like from the raw income model.
Okay, thank
Yes.
you. Uh, Dr. Hafiz, I hope that answers your question in some ways. So, can we say that we we don't look at how long a person lived to as one of the measure of successful aging. So it's a matter of how towards the older, when you're at old age. So what's the more like of the quality of life that you have during that stage of your life? Is it? Would that be more accurate then?
Sorry, Dr. Zaid?
Maybe it's not merely the lifespan, but the quality of the life at that age is more contributes more towards the how you measure successful aging.
Yeah, yeah, sure.
Mm,
We should have the good quality of life to achieve the successful aging. But in the current study of to explain about the successful aging, most of the study reveal that the theory of raw income model is also have limitation for to apply in this era. For example, for in the raw income model, the theory it cannot measure for the spiritual and maybe like quality of life. Maybe I think and I deal with the we should also achieve the quality of life for achieve the successful aging.
thank you, Dr. Lisa. I think it's very interesting when it comes to the. I have to admit that I personally myself have not looked into like Royco model that you mentioned on measurement of successful aging. It's very interesting. And we have another interesting question by one of our audience. If in the chat box, Dr. Lisa, if you can refer to it from Dr. Muhammad Akram from our UPM candidate. In successful aging, what is your comment for countries who propose an increase the pension age, such as from 60 to 65 years old. Does working at more older age means you are more successful? Okay, so this one regarding the increasing pension age or retirement age, actually retirement age. It's not just this one is thing for uh, many countries have considered this increasing the pension age, and some countries have some lashback from the community, especially like when you look at countries like France where they oppose
Mhm.
the increase of age of retirement. So maybe you can have we want to hear your opinion on this, whether increasing of retirement age, and does more importantly, does working at a more older age means you are more successful when it comes to related to our topic today.
Okay, thank you for the good question from the Mr. Muhammad Akram. In my opinion, every country have a policy for when we can retire their staff from the office. But um, if we look increasing the age of the at of the age for the retirement, such as 60 to 65. um, in my opinion, I think uh, maybe from the several professional, it's still be active for we work in the office. But from the other professional, uh, it it's not a good age for active in the office. And for the older adults who have age more than 60 or 65, is still active and engaged with the community, and we can still um, and they still contribute as a activity, volunteers and for not informal job. I think like that. But
Mhm.
the formal job, for the formal job, maybe every countries have a policy for when they retire the staff in the office.
Okay, thank you. I think this is a challenging question by Akram. It's a challenging question, difficult question, because this thing has also come out in the not just the academic sphere, also in the uh, layman, common man, in the news. So we do get some comments by our own public health experts in the country, and some of them do have differing opinions on with regards to this retirement age. But I think when it comes to this question, perhaps we can look at the final part where working at an older age, whether does that would that score more when it comes to the model that using such of successful aging, would 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 having a older population, working population, would they score more when it comes to measurement of the successful aging, or would it have any effect or points on the when it comes to successful aging?
Sorry, Dr. Zaid.
Dr. Lisa, can you hear me? Okay.
Yes, yes.
Right. So meaning that so you have the model that you use for successful aging.
Hmm.
So meaning that if that population have a higher population of old age which is working, very old age, more than 65 and above, how would that affect the score of the successful aging?
Okay.
Mhm.
Uh, automatically the score of successful aging if the country or the population have a wide or large percentage of older age. Is it good? It's good if the older adults have still healthy, still independence, and still have a successful aging. But the uh, if the population even have a wide or large older population but not have the healthy status for the older adults and not independent for perform the daily activity, it's still not good. I think that.
Mm. Yeah, okay. Yeah, thank you. Because this one is also related to the economics of the country, the needs of the
Yeah.
economics of the country, everything. We even have, I think, in among our audience, we also have some people who are very qualified to maybe give a comment about this. Okay, but there's a lot to cover when it comes to this issue, right? Okay, thank you, Dr. Akram, for the question, and yeah, he thanked Dr. Lisa for the explanation.
Yes, thank you,
Okay.
Dr. Zayed.
Mhm. Right. Um, Maybe we can, if we have any last questions, perhaps. Okay. If no, then I think that will be that we can wrap up for the second topic from the Dr. Licia. Thank you very much. Therefore, with these two topics that we have listened to today, I hope we can get some takeaway knowledge from this session. And on behalf of the organizer, I would like to apologize for any imperfections when it comes to the session today. Okay, minta maaf jika ada segala kekurangan uh, dalam untuk sesi kali ini. And we hope we can meet again. We will have another session CME sometime in the future. And I hope everyone is happy about today, and um, have a good day, have a good weekend for everyone. Okay, thank you very much for listening, and thank you for participating and all your questions, everything. And thank you for Dr. again, lastly, Dr. Khairunnisa and Dr. Lisa for contributing on today's CME. Thank you very much, everyone.
Yes, thank you, Dr. Zayed, Dr. Nisa, and all
Mm,
participants.
Terima kasih semua. Thank you.
Thank you. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.